Bartholomew Town is brought to you in part by the University of Rhode Island Online, Navigant Credit Union, the Audubon Society of Rhode Island, Newport Film, and Half Street Group.
Bartholomew Town.
We obviously have a lot to discuss when we take a look at the healthcare situation in Rhode Island. And I say situation because you can call it a crisis. There is a crisis, but it's multifaceted. Of course, chief among the conversation right now has been Anchor Medicine closing 25,000 patients primarily in northern Rhode Island are about to lose their primary care physician. But this is an issue writ large. There's many reasons for this. Reimbursement rates is part of it. And then, of course, on an infrastructure level, for years now, we've talked about the broad challenges with the healthcare industry, so to speak, potential mergers and partnerships that have formed with major organizations and really, frankly, nonprofits and universities. This is all swirling in a moment where we also still have resonating mis and disinformation, and people, as we were just saying offline, who are fabulous at their job but maybe aren't epidemiologists yet think they're epidemiologists. That's still out there. Dr. Phil Chan, no stranger to Rhode Islanders, no stranger to Bartholomew Town, here to talk about Rhode Island's healthcare crisis with us. Doctor, thanks so much for your time.
Thank you for having me, Bill.
Biggest problem in healthcare right now in Rhode Island is
primary care access, for sure.
Why do you think that rises to the top? I mean, it makes sense why it would be a huge issue, but what's driving that issue?
I think that anyone that has tried to find a primary care provider in the last several years can attest to the fact that it is difficult. Long wait times, difficulty finding places, even accepting. And I think, as you allude to, it is due to multiple factors. At the end of the day, though, there's just very low supply and very high demand for primary care access, something that's more of a systems issue that we have to fix here in our state.
What's the biggest system breakdown right now? Is it the reimbursement rates? We hear that so often, even casually speaking with medical professionals about, I can go make more money from reimbursement rates in Massachusetts or Connecticut than I can in Rhode Island. So on a business level, it just doesn't make sense to be here in Rhode Island. Then we also hear about appetite to enter into the field, especially post-COVID, and that trickles down throughout all sorts of professionals, not just medical doctors, but whether it's physician's assistants, nurses, CNAs, I mean, you name it, there seems to be, I don't know the numbers, there seems to be less of an appetite to get into the industry. What's driving this more than anything else, though?
I think it does come down to an issue of money and funding, unfortunately. And it is a catch-22, right? Because of these low in reimbursement rates, the clinics and the organizations themselves are reimbursed at a lower rate and oftentimes hurting. And that also results in lower payment to staff in general, including physicians and physician assistants, MPs. And that makes it harder to attract. And yes, to your point, physicians in general can make 20 to 30% more by going just across the border and practicing in Massachusetts. The other big issue, of course, is disparities. And this is more of a systems issue. But primary care docs just earn a lot less, which is why we have to increase their payments as much as possible to attract good talent, especially compared to surgeons and others who may earn upwards of $800,000, $900,000 per year.
Yeah, the specialists and, as you say, surgeons versus the what you would call a family doctor. What about what we saw in COVID? I remember early on in COVID taking a look at some zip codes and percent positivity rates, and it was pretty clear that when we compared the highest percent positive rates to health equity zones and areas where brick and mortar access to primary care or even walk-in clinics, so on and so forth, where that was reduced, we saw a higher rate of positivity. And that was a red flag, of course, just in terms of how we've built our medical infrastructure on a disparity level and at an access level and equity level. Have we corrected that? Have we started to move the ball forward on, Central Falls? There was a moment, I remember we were in one of the press conferences for COVID, and it was like 29% positivity rate in CF. And you're like, how could this happen? Have we gotten past that moment?
Unfortunately, no, I don't think we have. And, a few years ago it was COVID, but I think that the COVID theme overlies so many different other health topics because we see those disparities for many, many other things. And they were very predominant and highlighted during the pandemic related to COVID, of course, but we see those related to HIV, sexually transmitted diseases, obesity, right, chronic diseases. So it's something that we continue to see for sure. I am reassured, though, that we do have a good safety net system here in the state of Rhode Island. So my colleagues at our federally qualified health centers, places like Blackstone Valley Community Health, Providence Community Health Center, et cetera, really are the safety net providers. And a lot of them do practice in places like Central Falls, Providence, Pawtucket, et cetera, and deliver cutting edge, great care in those settings.
And as far as moving the level of access or the amount of primary care doctors or specialists that work with those organizations, as far as increasing that, what's it going to take if you're a physician right now and you're saying, geez, do I want to get involved in that aspect of the business? Is that something that is reasonable to assume could move forward?
It is, and there has been a lot of great progress in the state, I think. A lot more to do, and certainly not necessarily fast enough for a lot of us as we would like, but there is progress, and this problem is rightfully so getting a lot of attention. I think the solution is there's multiple things that need to be done in order to solve this problem. And if you think about this as a supply issue of primary care physicians, the first is we need to train more. Right. So it's so competitive to get in medical school. Medical schools in general turn away a lot of very, very qualified candidates. That's why I'm a huge supporter, for example, of another medical school, potentially, University of Rhode Island. I think that would be a great idea, focused on training primary care providers to increase just the number who are likely to stay. And then I think we got to incentivize more physicians and other providers, nurse practitioners, physician's assistants to stay in Rhode Island by doing a number of things. For example, paying them more, at least competitive with states like Massachusetts, and investing in loan repayment programs and other sort of incentivized programs for them to stay in the state.
What's burnout rate in terms of its role in all of this for people in healthcare as a whole? I mean, so what if you're making a good salary, if your life is filled with bureaucratic struggle and a system that seems to be working against you, that even with the most reasonable, strong-minded person with an athletic background or whatever other level of adversity they've been faced with in their life, whatever tools they have to face adversity, it's reasonable to assume that burnout rate would be severe. What role is that playing in all of this? It's
a huge role here in the state of Rhode Island, as well as across the country. We are having very high rates in not just physicians, but really across the healthcare spectrum. I think some of that is due to COVID. I think there was just a lot of stress and challenges during the COVID pandemic, but we've also seen it continue. And a lot of that is driven by these administrative processes that you mentioned. Things like our electronic medical record system, our EMR system, things like prior authorizations and other sort of administrative burdens really do place a burden. And I say that as someone that practices medicine. I do spend a lot of time, and I have to dedicate a lot of my staff's time to deal with this sort of endless paperwork that we see. And certainly none of us, right? None of us in medicine have this job to do paperwork. That is right. The worst part.
It's government can do a lot. Government doesn't have a magic wand, but are we doing enough? I mean, is this being taken seriously enough by the executive and legislative branch at this point in time in terms of, look, the whole broad issue of not just anchor medicine, not just primary care physicians and the challenges with reimbursement rate. These are all they're big issues, but they're micro issues within a broad infrastructure of challenges. Is this high enough on the priority list? Not even naming political leaders' names, but do you get the sense that people understand how severe this is relative to other issues in the state, like housing or transit or education? Is healthcare right up there? And if not, why not?
Yeah, so great question. I do think that it has gotten there. It's taken some time. Governor McKee announced a couple weeks ago some actions on primary care. The General Assembly has been on top of it and looking at a number of bills. So I do think that there is great progress. I do want to acknowledge our state leaders. I feel very blessed in Rhode Island. And I think the other important to think about for healthcare, right, is a lot of people take jobs based on healthcare access, housing as well. I would also argue that housing, of course, is a very important both public health and medical topic that we need to get a handle on, but also just access to healthcare. I mean, a lot of people take jobs or don't take jobs based on benefits, including access to healthcare. And if you can't find a primary care doctor or a specialist in the state of Rhode Island, I think that that's going to have very important ramifications for our economy and potentially people looking for jobs in our state.
Your diagnosis, optimism or pessimism, is the appropriate mindset to have right now when looking at the healthcare system and getting out of the overall challenge jam in the next, well, we'll just put, rather than assign a number to it, in the foreseeable future. Do you think it's reasonable to be optimistic now, or is that pessimism necessary to get the ball rolling so we can get to a place of optimism?
I remain optimistic. I see a lot of good movement. I am a little bit worried and concerned about some of the proposed Medicaid cuts at the federal level. I think Medicaid in general is so important. It's so important for the state of Rhode Island. We get a lot of, quote, matching dollars, which means that we have a lot of funding coming into our state for Medicaid. And I understand, right, we have a budget deficit in our state. So there's some difficult decisions here about what to spend every dollar on. Every dollar is important. But I do think that healthcare needs to be prioritized in our state. I think if people don't have their health, then a lot of things fall after that.
Yeah. And last question, sort of the drivers of good health outcomes, access to food. We certainly do have food deserts in Rhode Island. There's no question about it. And access to healthy foods and culturally appropriate foods, open space and opportunities for recreation. These types of access pieces, in tandem with everything that you've just outlined as solutions, how do we continue to educate leaders more than anybody else on the importance of emphasizing open space, access to recreation, access to healthy food, so on and so forth, in a way that doesn't just seem like, okay, well, we've got to do the public service messaging, everybody eat an apple a day, everybody go for a run if you can. How do we integrate this into our biorhythms in a way that is more realistic for the average everyday person to turn around and process?
Great question, Bill. I think as we talk about some of these very complicated topics, and I may even add mental health and potentially substance use to your list there, as well as housing, of course. I think we have to focus on evidence-based approaches. We need to be collecting data. We need to learn about what works and, importantly, what doesn't work, and always continue to adjust our approach and learn from the programs that we implement. None of us have the right answer. And certainly, again, these are complicated topics. If we could have solved them, we would have. And they're going to require some money. And I think we just have to focus on the evidence and the data and having discussions and coming together as a state, cross party lines, to have these difficult discussions about how to solve some of these very difficult challenges.
Yeah, you mentioned mental health. In the latest data I saw, 2022 to 2023, 58% increase in calls to the suicide and crisis hotline here in Rhode Island. Mental health front and center, and of course in its own category, but also a major driver of health outcomes writ large. Dr. Philip Chan, as always, thanks so much for your time and for all you do for the state.
Thank you very much for having me.
Hey, thanks for stopping by Bartholomew Town. For more content, follow me on Instagram @BillBartholomew.